Almost 50% of adults aged 30 years or older have some form of gum disease, and that increases further with age. Around 70% of adults aged over 65 have some form of periodontal disease. But gum disease doesn't just stop there. Gum disease has been linked with more serious conditions, things like cardiovascular disease, that's heart attacks and strokes, diabetes, and even Alzheimer's disease. So what is gum disease? Why do we get it? What causes it? How do we fix it? How do we even know that we have it? Well, let's start there. How do you even know that you have it? So a lot of the time people will know that they have gum disease because they've been to see their dentist, and the dentist might have told them, hey, you have pocketing around your teeth, or you've got this or you've got that. But if you've never been to the dentist, how would you know if you have gum disease? The most common signs of gum disease would be swelling in your gums, redness in your gums, or your gums will bleed whenever you brush them or if your dentist probes them or pokes at them. However, your gums don't always bleed whenever you have gum disease. For example, if you're a smoker, then that reduces the blood flow to your gums and they might not bleed, so you might not even know that you have gum disease, and smoking is a very big risk factor for gum disease. So the best way to know if you have gum disease is to go and see your dentist and get the pockets measured around your teeth, and that's the best way to know if you have gum disease. They also might take x-rays that'll help them diagnose the problem, that'll let them see where the bone is around the teeth, or also if there's any plaque that's built up around the teeth as well. So the best way to know if you have gum disease is to go and see your dentist. So what actually causes gum disease? Well, it's bacteria. Bacteria in your mouth that build up around your teeth and that stick against your teeth, and that over time can become mineralized and cannot be removed with a toothbrush. The bacteria start off in your mouth and they build up around your teeth, and they're in a biofilm, a sticky biofilm that sticks against your teeth, and that's what we call plaque. Over the course of 24 hours, if that plaque is not removed, your saliva will mineralize that, and it only takes about 24 hours for that to happen. After it becomes mineralized, it cannot be removed from your teeth with toothbrush alone. You have to go and see a dentist to get that removed. Now, I don't want to cause any confusion here by saying that saliva is bad because it causes the plaque to mineralize. In fact, saliva is amazing. It's one of the best things that we have and one of the best defenses in our mouth against dental disease. But the bacteria have worked that out as well. And our saliva, the same way it can remineralize some of our teeth, it also, because of what it has in it, can start to mineralize this plaque biofilm, and that's what causes tartar to form and calculus to form that hardens onto the teeth. And ultimately, it's this plaque, this calculus, this tartar that's built up around the teeth that harbors all of these bacteria. That's what's causing gum disease or periodontal disease. There are different types of gum disease, and one of the most common ones that we'll have heard of would be something called gingivitis. Gingivitis is a form of gum disease, but it's a very early stage of gum disease where it only affects the gums, the tops of the gums, and it doesn't progress any further than that. If gingivitis is left untreated or it's not taken care of, that inflammation in the gums can start to progress further, and that's when it starts to become something called periodontitis, or a more advanced form of gum disease. The difference between gingivitis and periodontitis is that periodontitis, as it spreads further into the gums, it also starts to affect the bone. And your jawbone around the teeth is the foundation for those teeth. And if that starts to get damaged, it can get lost, pockets can get bigger. Eventually what will happen, as that foundation around the teeth is lost, the teeth will start to become wobbly, they'll get sore, and they have to be taken out. So how do we fix this? Well, it's actually quite easy. The best thing that we have to protect against gum disease is a toothbrush. Because what's causing the gum disease is plaque, it's that buildup of plaque and bacteria, physically removing that plaque is the best way to defeat gum disease. But toothbrushing alone isn't going to be enough, because a toothbrush will not brush every surface of our tooth, even if it's an electric toothbrush. It will not reach in between teeth in most cases. So often people have to use floss or floss alternatives, things like interdental brushes or floss picks. Those are things that we can use to help clean in between our teeth. Good home care and good plaque control accounts for maybe about 75% of the actual success of treatment of gum disease. If you're not looking after your teeth in the morning and at night time, the treatment that you use for gum disease will not work. The other 25% of that treatment is actually getting cleaning done with your dentist or with your hygienist in their office. Most important is good cleaning at home and making sure you're keeping up and maintaining the cleaning that you've had done. You may need to go back regularly to see your dentist or your hygienist to check how your gums are getting on, and you may need more cleaning. There are other risk factors as well at play, like do you have crowding in your teeth, do you smoke, do you have other systemic conditions, things like diabetes would be a big risk factor for gum disease as well. But the most important thing is that you're cleaning your teeth well at home, brushing them twice a day and flossing them at least once a day.